There you go.
Got it.
Morning, everybody, and welcome, welcome. My name is Dina, and I am the founder of Pain to Possibilities and the Change Pain Academy. And I am the host of the Willow Chronic Pain and Trauma Summit. Today, I'm really excited to invite our esteemed guest, Robyn Brickel. Robyn is a licensed marriage and family therapist with 25 plus years of experience providing psychotherapy, as well as the founder and clinical director of a private practice, Brickel and Associates, in Old Town, Alexandria, Virginia. She and her team bring a strengths-based, trauma-informed systems approach to the treatment of individuals, adolescents and adults, couples and families. She specializes in trauma, including attachment trauma, and the use of dissociative mechanisms such as self-harm, eating disorders, and addictions. She also approaches treatment of perinatal mental health from a trauma-informed lens. Robyn also guides clients and clinicians who wish to better understand the impact of trauma on mental health and relationships. She has a wide range of postgraduate trauma and addictions education and is trained in numerous relational models of practice, including emotionally focused couple therapy, EFT, the psychobiological approach to couple therapy, or PACT, and imago therapy. She is a trained sensorimotor psychotherapist and is a certified senior facilitator, trauma-informed stabilization treatment, or TIST. So we're utilizing all these tools, along with mindfulness and ego state work to provide the best care to her clients. She prides herself in always learning and expanding her knowledge on a daily basis about the intricacies of treating complex trauma and trauma's impact on perinatal distress. This is why you are here today, because you have such an extensive background, and I'm so excited for our conversation. So today, Robyn, and for our listeners, our topic is EMDR for trauma and chronic pain. And I do have to say, we worked really hard to make this interview happen. So thank you so much, Robyn, for being here. I know you are a busy gal.
You are welcome. Thank you so much for having me.
Oh, no problem. And sorry about the bungles in here.
It's okay.
Oh my gosh. Okay.
It's okay.
So, Robyn, a little bit of backstory about you. So what brought you into this field? How did you get to where you are now?
Sure. I am a licensed marriage and family therapist. Back when I was deciding what to go to school for, there weren't a whole lot of options back then. And what I liked about the marriage and family therapy program was it looked at systems. It wasn't very singular. It was looking at the whole picture, thinking of families back then, but really looking at what I call kind of the system of the body, the person, the world, etc. So I began my work early on in working with addiction, and what I now call dissociative mechanisms, and seeing how people will really try anything to just feel less badly, right? That they just don't want to feel their pain.
Right.
And so whether it's addiction, whether it's self-harm, whether it's use of food or eating disorders, right? People are attempting to just feel better.
Right.
And it made me realize that there were a lot of systems that existed within inside people, and how things work together, how the nervous system worked together with feelings and emotions and physical pain and sensation. And I now practice in Old Town, Alexandria, Virginia. I run a group that works purely from a trauma-informed lens, and we treat people who either own their trauma or don't, sometimes show up with anxiety or depression and not understand sort of where that comes from, and treat it from a way that is strengths-based and non-pathologizing, and helping people understand that right, they've survived a lot in life.
Yeah, no, so well said. And that's why I'm thankful for this message, because there is a beautiful overlying theme in this summit, is that we are bigger than we think we are, in the sense that we are such a combination of so many systems. And so, and the beautiful part is so many different speakers are from different, denominations or different expertise, and it's still the same message. So there you go. All right. So for those listeners who don't know what EMDR, first of all, what does it stand for, and what is it actually?
Sure. EMDR is eye movement desensitization and reprocessing. It's a form of, form of psychotherapy developed in the late 80s by Francine Shapiro. It is basically something that uses bilateral sensory input, so back and forth from right to left, both sides, and the goal is to basically achieve processing of memories and information the way the brain is supposed to.
Okay.
And sometimes when trauma happens, information gets stuck and it doesn't process fully. The normal processing, the healthy processing that happens regularly, happens a lot during sleep. So think about rapid eye movement, and EMDR mimics rapid eye movement.
Oh, fantastic. Okay. No, well, that's all we need. That's the session. No, that makes complete sense. I know you touched a little bit on sort of how it is that it works, but can we take it one step further and maybe just give them, our listeners, a little sense of, not too nerdy, but a little bit of science behind it, just a general sense.
Sure. And you'll tell me if I get too deep into it. Basically, EMDR is what we call a bottom-up processing.
Okay.
So it happens from the body versus just the thoughts. And so basically what happens is when the information gets stuck in the brain, right, the EMDR mimics that process. And so what we can do is help the nervous system calm down, basically, and understand that you're safe today, assumably, when you're doing EMDR, and be able to hold both the safety of today and the memory of the trauma and link those together. And so what that does is it changes the neural pathway of the brain and how we process information, so that what we connect it to is safer, is calmer, is processing it through, that you've made it through. And EMDR relies on something called the adaptive information processing model. And basically that's just the model that says, right, how our brain adapts information, right, and how we process it through, how we gain health, how we make it through trauma in a way that doesn't leave it stuck on the body.
Oh, not sciencey nerdy at all. That was perfect.
I tried.
That's perfect. So, and you know what, you just explained the whole chronic pain thing, because that is really the difference between acute, or that short-term, injury tissue, to the chronic state. So there is so much overlap here. Absolutely.
It's very similar to what I would deem PTSD, single incident trauma, to complex trauma, chronic relational developmental trauma.
Okay, so that's a great point. Does EMDR address both similarly?
Yes and no.
Okay.
So single incident PTSD trauma, if there is a secure base foundation attachment for clients, that single incident trauma processing can go much faster. Because we don't have to work on building that foundation. For complex trauma survivors, we have to start from the beginning, and we have to build in the safety and stability first, which is most important, so that people can stay present in the moment. So EMDR has this idea that when you're processing, you have to have at least one foot in the present moment, right? You have to be able to come back to where you are now. And for complex trauma survivors, right, probably similarly for chronic pain, right, when it happens so often and is so part of who you are, it is harder to build that. It takes longer.
Right. No, that makes complete sense. So knowing that pain and trauma have so much overlap, and they both deal with both the physical and emotional, always, how does EMDR actually serve the emotional self?
Sure. I mean, EMDR is meant for healing that emotional place, right? It's meant for developing and helping us have new neural pathways and connections in the nervous system so that basically the stress response can be less intense. And so it helps people stay grounded in the present moment versus feeling flooded by intense memories. And when the nervous system is calmer, right, the intensity of pain, emotional or physical, right, felt by trauma survivors is less, right? The activated nervous system is calmer. And so, right, really similar to all the things that happen when, right, when you're feeling intense pain and you can't get out of that cycle, right? You're kind of stuck there. And the same is true when you're flooded by an emotional memory. Pain and emotion to me are so linked, right? Because trauma is really stored in the body. And so it's stored in the nervous system. And pain is trauma. Trauma to the body, trauma to the emotions, right?
Absolutely.
Both. So it's really so connected. And so EMDR can help link the neural pathways to be something different to help calm that nervous system and give you a clearer picture of what's happening today.
Beautiful. Oh, yeah. Okay. Well said. And I remember what I was going to ask you.
Okay.
When it comes to treatment, I know there may be some listeners who are concerned, whether it be through cognitive behavioral therapy or any sort of therapy that they work towards, is addressing those deep emotions. Is there fear of getting into the situation where they're having to confront those deep emotions? So how do you talk through someone who might be fearing that even before they begin?
Sure, right. Like a lot of people come to the table with things that they've put aside, they don't want to deal with, or they think they already have. Right. The job of a good trauma therapist or trauma-informed therapist is to really go at the pace the client needs and to keep them in what we call sort of the window of tolerance, which is this place where you can think and feel at the same time and not go above or below. So it's a real dance between the two. I think that sometimes we think we've dealt with things that unfortunately we haven't and are still living on the body. I think it's an important relationship between the client and the therapist to be able to talk about it and to build safety. The most important piece of any trauma-informed or trauma therapy is safety and stability. So we can't do anything else until that happens. And so that is, according to Judith Herman, who is an amazing founder of the 3-stage trauma model, right? That is the most important and usually longest part of therapy. And so really relationally building that space that feels safe enough to talk about the hurts and pains and to be able to say slow down when you need to. And one of the benefits of EMDR is that you don't have to go through all of the details of the trauma and the pain. It's sort of a fast forward kind of model. And so allows the trauma processing to happen in the links of the neural pathways. And so allows it to be a little bit easier at times through the details and the hope and the striving for is the healing, the feeling better, the things that everybody comes to therapy for.
Right. No, well said. You're weaving it beautifully together because very much a part of, equally as part for the chronic pain experience is that safety, right? That's the only way to, not the only way, pardon me, one of the very important ways to help a person reach recovery. And recovery looks different for everyone, right? It's one of those words that we use, we want to be careful of, but is the safety, creating that safety and stability. So thank you for, okay.
That's everything.
It is everything, absolutely. But it's a lot of work. So we simplify it by saying it, down into 1 or 2 words, but it takes a lot of work and trust, like you said. So that actually brings me to my next point. What would a treatment, an EMDR session, typically look like and feel like?
Right. So it depends. EMDR is really a comprehensive therapy model, not just a tool.
Right. Okay.
And so EMDR can collaborate and work with lots of other models of therapy. Like in my bio, when you talked about, right, that I'm trained in all of these different models because I weave them all together to figure out what is the best for the client. And EMDR allows you to weave in sensory motor psychotherapy, ego state psychotherapy, etc.
Okay.
Many people, especially in today, because EMDR is in the press everywhere, believe that EMDR can be like magic,
Right.
and treat trauma in a few short sessions.
Yeah.
I mean, again, if you have single incident
Yes.
trauma,
Perhaps.
possibly, yeah, absolutely.
Okay.
If there is more chronic, right, relational, developmental trauma, chronic pain, right, something long-standing,
Yeah.
it will take longer because you have to work on that safety and stability. I think that a lot of people, when they say EMDR, they mean the bilateral stimulation, right? What happens when you've seen, right, people have seen a lot of the videos on TV or Prince Harry on TV, right? And you see like the eye movements.
Yeah.
The bilateral stimulation is part of EMDR. It is not all of EMDR.
Okay.
So a standard session is going to look, right, the beginning of therapy is going to look like, right, building that rapport, that safety, that stabilization, right? Taking a history, doing sort of treatment planning and preparation, right? Resourcing, teaching clients containment, how to be able to leave a session and be okay and not be outside that window.
Right.
So I think that it depends. The bilateral stimulation part where your eyes are moving, or you're working with tappers, or there's lots of different ways we've learned to be able to use bilateral stimulation, even walking, right, drawing, things like that. So it really depends. The beginning, the biggest thing that I can say about any good therapy, EMDR included, is that it concludes with some sort of containment so that whatever you've opened up in the session, it's safe enough to hold until the next session.
Oh, I love that. I love that. Especially when we're talking about a sense of safety coming in, safety going out too.
Exactly. That is the hope. For all, therapy is not easy, and it takes a lot of courage to address our issues. And I think it is the mainstay of a trauma-informed model for safety, right? And respect and kindness and compassion. And so my goal is that although my clients have worked during that time, they walk out feeling safe, either safe in the relationship, safe in themselves, safe in handling it or managing it or just putting it away.
Yeah. And do your clients ever come back to you and sort of review what they felt after they were done? Were they able to sort of express what they felt? What sort of examples are you seeing?
Absolutely. I mean, part of the work is to ask our clients, right? Like, so how was that experience? And a lot of the work, especially with EMDR, happens in between sessions. So things come up, right? The goal is to change on some level the way the processing happens. So the connections of the neural pathways. So as I'm hearing about what's going on, I can hear, are those changes happening? Are they sticking? Or are they not?
Right. Oh, amazing. And the overlap between the chronic pain experience too, or at least working through to recovery, is that sort of unwinding, which, like the work you're doing, it really takes time and and all the words you stated, patience, perspective, trust, all that stuff. Okay. And safety. Yeah. Sorry.
No, it's okay.
My brain could really find the words. That would be great. Can these be done virtually, or do you prefer it face to face?
Yes. So I think it's a personal preference of the client and the therapist. right, I have been practicing a long time before virtual really existed. And so my mainstay is in person. During COVID, we learned that lots of things could adapt, right? Just like the adaptive information processing model, right? We could adapt to doing things online. I think it really depends. EMDR, bilateral stimulation can happen online. There are lots of programs that that developed over COVID, and the tools are amazing. I think it depends, right? I see a lot of chronic, complex trauma survivors, some of whom have trauma around video or things being filmed. And so I personally am pretty old school and I like in person best. I've done EMDR, bilateral stim in person masked. And so I can still see the eyes, right, to keep people safe because, that's safety is the most important piece. So we want to be sure that coming into my office feels safe. And so, I have my mask always. And so, we can do that both in person and virtually. I think it depends on the therapist. Some of my colleagues absolutely love virtual. And some of us
Yeah. Yeah. No, I understand that completely. I think it's always going to be a bit of both, isn't it?
Yeah.
Yeah. So. Okay. Amazing. So is there ever a time when EMDR is not recommended?
I think as long as therapists are trained and skilled at both EMDR and trauma, then therapists can use their skills to evaluate the best model of care at the time. Again, remembering that EMDR is a therapy model, so potentially bilateral stim for reprocessing, which is one of the phases of EMDR, but it's not all of EMDR, might not be recommended ever the first day of treatment, we have to assess for safety. We have to do history taking and evaluation and make sure that the clients can keep that one foot in the present to be able to do it. So I think that EMDR as a therapy theory, as a model, there's no contraindications. I think that is about the therapy and the therapist and the client collaborating on what's best for the client at the time.
Yeah. Okay. No, I think that's a great point. All right. Based on your professional experience, if you were to give our listeners one really big nugget, what would that be? It's a big one.
It's a big one. I'm not, but there's, nobody can tell you how many sessions it will take. There's no time frame for therapy. There's no right or wrong in the way that that the client does therapy. And to take your time, there's reasons that the body and the brain may have protected you for years from information, and building that safety and stability as a foundation is the most important thing. So if you walk into a therapist's office and they're wanting to wave their fingers in front of your eyes in the first session, maybe think again.
Right. Good point. Yeah. I think it just goes to show, like everything else with the human body and the lived experience with trauma and pain, it's multifactorial. There's so many, we're complex in a beautiful way. Yes. Yes. Okay. So is there anything that I may have not brought forth in our conversation that you think is really important for our listeners to know?
I think, EMDR is phenomenal. I've been trained in it since 2001, so I clearly believe in it. I'm an approved consultant, so I help newer therapists learn how to incorporate it. I think therapy in and of itself and looking at the connection between, especially for pain and emotions, there's no way they're not linked. So how do we find a way to just calm the nervous system so that we can be present in the moment and see what's going on?
Right. Oh, well said. And that is the beautiful overlap with pain too, is that nervous system.
Yeah.
If only our listeners could hear that right off the bat, that your nervous system in chronic pain is
Dialed up.
dialed up. Exactly. And that you have some control, right? You have some control over that process. So
Yeah, you can, right? There are lots of things that can be done to work with the anxiety and the dial up for
yes,
chronic pain and the emotion to be able to really slow that process down.
absolutely. And even for trauma, I know it's different as far as, but there are still things, right, that can be done.
Absolutely.
Yeah.
Absolutely. There is, I do what I do for a living, and I have hope and joy every day getting to walk alongside my clients on their journey toward healing. It's amazing.
Oh, well, you're amazing.
Sweet.
Oh, so I just wanted to, pardon the sunlight here, I just want to bring attention to your blog. Where can people find more information about your blog, but also about you?
Sure. On our website, which is brickelandassociates.com, you can read about myself, my staff. You can read about EMDR. You can read over, I don't know, 100+ blog articles that I've written over the last 6 or 7 years. Every time something strikes me, or I think there needs to be more information about something out there. So I think I think there's a wealth of information there if you want to look at it.
I have seen it, and yes, there is a wealth of information there, so I highly recommend it. Well, Robyn, thank you so very much for your time today. And I know you're very busy, and I really appreciate you taking time out of your day to help our listeners. I'm not just emotional, I'm a little cough. So thank you. I really
Morning.
yeah, it's the morning, exactly, as you can see by the light coming in. Thank you again. I really appreciate it.
Absolutely. Thank you. Thanks for reaching out, and I'm happy to be able to help.